Thank you everyone for coming over from Health Supply Hub. Great that press was generated over there, so I didn't have an empty room here. So as mentioned, I'm Jess and I work with the mSupply Foundation. Thank you. And I'm one of the project managers who works with our Conforma software. And so today I'm going to give you a little bit of an intro about Conforma, and then also pass on to Emi, who's going to actually talk about how it's worked in practice. So Conforma is our integrated regulatory and workflow management system. This is a lot of fancy words. It's basically a very flexible tool that allows for applications to be submitted and processed through a customizable pathway that suits each country. So when I'm saying flexible, I mean we tailor it to each country's specific needs. All right, it's not just limited to regulatory authorities. When I'm talking about regulatory authorities, I know a lot of the countries in the room right now may not have a large regulatory authority team or even a reg office. What I'm talking about is regulatory practices, which include things like importation processes, pre-qualification of medicines, and then furthering down, we're also talking about drug registration, which is becoming a focus within the region, as you might know, through the TGA's involvement of the regulatory strengthening program. So that's how we've been involved with Fiji. So on the screen here, I can actually, all the videos, it's actually the Conforma system that's playing to give you a little bit of a preview of what's happening here. So we wanted to provide a tool that would fit any country. So right now we have Conforma is being used in Fiji and for Angola as well. So we wanted a tool that was scalable, flexible, that could be used in a country of 40 million or for a country like Fiji with a smaller regulatory office with only a few staff. So the tools are the same. We need to be able to effectively get good quality applications. We need to be able to review them in a proper and efficient way. And we need to be able to store that data and pull it up and use it for other interrelated processes. As we know, regulation isn't the last card in the line. So when I'm talking today, even if your countries are not doing medicines registration, we can't think of it as being separate from the supply chain. When we're talking about bringing products into our country, we really want them to be high quality, safe and efficient medicines. All the supply chain strengthening work, everyone's doing in the room, it's only as good as the patient getting a quality medicine all the way at the end of the patient clinic. So yes, our aim is to increase access to quality and safe medicines in all of our countries. All right. So the motivation behind Conforma, I touched on some of these already. We wanted to remove barriers to efficient regulation. So Conforma is an open source software, which means no licensing fees. Also, it is able to be set up and configured without development. What that means is that it's not a costly experience to tailor it to an individual country's needs. So it's something that can be set up and adapted and be used sustainably. As we know, regulatory processes do not stay the same, and countries, processes and teams do not stay the same. They grow and change, adapt and get better. So with Conforma, we're able to update your processes without having to go send it back to developers for more cost, and we're able to update the system. So an example is Fiji with their provisional medicine system. We're taking a smaller subset of product data, which will in the future be able to be used and fill in for the full product registration to take a higher level of data and be evaluated. We also wanted it to be a one system for collecting data and work. So we don't want staff in small teams. It's been a theme throughout their presentations today that everyone knows that the health workforce is stretched. So we wanted it to be that all the processes the team could manage could be efficiently done in one system. So that means our medicines registrations, import permits, or any application you can imagine can be managed in the one system. And that means when you log on for the day, you'll see your workload in the dashboard, that it's all there. We want it to be interoperable. We can't talk about regulation, as I mentioned, without talking about supply chain. So Conforma was designed to be interoperable with other softwares, and we hopefully would like to see it being implemented with Open mSupply or mSupply so it can connect to our supply chain data as well. So as I've mentioned, it's easily customizable and can be updated. I think one of the best things, though, it replaces complex manual processes. I don't know about everyone here, but storing bucket loads of paper is not a feasible solution for most places. Being able to store them securely and electronically and digitally and be able to pull them up at any point in time, and also not having to receive them in the post via mail can speed up processes a lot. It also stops for data entry and data entry errors, so we're getting higher quality submissions. The last part is it's user-friendly, super easy to use. So part of our experience in training the Fiji importer companies, we had, I think, over 30 companies. Emi might be able to touch on this more. And from what I hear, everyone said it was easy to use, and it was a very short training session. So this leaves well for continued expansion and use throughout the region. And hopefully as well, our team is nice and friendly to work with. All right, so I've talked a little bit about what Conforma does. So I mentioned that it's allows for applications to be managed and turned into database. It doesn't have to be for regulatory processes. It could also be for a process such as managing procurement requests for medicines or HR. So it could be anything that basically you submit something and then answer yes or no, or send it back, needs to be submitted. Conforma is able to manage complex workflows. So we know that every country has their own processes, there's senior staff, there's junior staff. Not everyone needs to be able to make the same decisions. Not everyone needs to be able to see the same information. So on the screen here, I have an example of medicines registration. So that can be a more complex process that goes through screening, evaluation, and often leading to a final decision. So these can all be handled in Conforma with different staff having different permissions for a different stage. We're also able to track the history of applications and the current process. So that's also helpful for applicants to be able to see the status of where they're at, so they're not always emailing and following up. Here's an example of a medicine in the database. So the whole purpose of getting these applications is to get the data in here so that you can use it for a critical time. So here's an example of Ventolin, being able to see who the manufacturer was, what it was approved for shelf life. These are all things that can be critically important in our supply chains. All right, so I've mentioned it can manage lots of different things. Here's some examples. So the big one is, of course, medicines registration. So building a comprehensive database of products that are both safe and quality, so you feel good about supplying them in your supply chain. We've also got pharmacovigilance reporting to allow for the reporting of critical safety signals. So one example is managing adverse drug reactions. The benefit of having it in Conforma allows for it to be actually linked to the registered products. So if you're getting a lot of safety signals for a particular product, it can be linked up particularly to that registered entity in the database. That can be the same for any other sorts of signals, such as medicine defects. We've also got quality control processes. So all of the countries here would have different pre-qualification standards. So managing the quality of products that we're procuring. So a common one is ensuring that our manufacturers are GMP compliant, or at least have been approved by another regulator in the region. So this helps to make the process more efficient, build a database of trusted manufacturers and products that you would feel comfortable procuring, as well as making it a more consistent process. So not allowing one supplier to submit a smaller subset of documentation compared to another supplier. We want everyone to be submitting high quality information about the products and manufacturers within the region. Lastly, as a different example, we can also do something like the registration of health professionals or facilities. So on the screen here, I have an example of a nurse registration form. So we can take in all sorts of information, including information about their education and employment or where they're working. And that kind of information can be used to create a database of registered health professionals. Can be kept up to date with a renewal process to keep track of where they're actually working. In times of a crisis, this could become important. So it's one thing to know what kind of nurse someone is. So maybe we're looking for someone who's a midwife, and we're able to see in the database that they work at a nearby facility and have their details to give them a call. All right. So I've mentioned we have customizable application forms several times now. So on the screen, it's going to play and show you an example of one of the forms. We go through a requirements gathering process when we set up Conforma. We, of course, have a base level of information that we suggest you collect about your products. But we, of course, would like to go through with each country and make sure it fits the actual needs for the users. So here we can see we have a built-in list of active ingredients. So we're using internationally standardized terms to make sure we're getting the proper standardized terminology coming through that allows for proper data sharing between countries, allows for reporting to agencies such as WHO or UNDP, for example. And so we incorporate these standardized tables within the system to make it easier to get high quality submissions. So instead of allowing free text, we're ensuring that dosage forms have to come from an approved list of dosage forms. These tables are owned by the countries once we set up the system. So I should mention the whole point of Conforma being open source and having no licenses is that the data within it is yours. It's your system to tailor. That includes the lists that are provided if a country such as Fiji wishes to add an additional 10 dosage forms to their list. It's very simple to do without help from me, can be done by the staff, and then those new 10 options can be added. So part of what we are trying to do in strengthening regulation in the region is we want to make a tool that's easy to use but brings in good practices for regulation. So we have good review principles that are the basis of WHO for how we should regulate medicines. So a couple of examples of how we built that into Conforma is multi-level reviews. So it's always good to have more than one person look at something for transparency. I understand that not all countries are going to have the ability to have multi-level reviews. It's something we can turn on, and change depending on the level of staff you have, or depending on the staff's permission. So a junior staff member might not be able to approve something, for example, it would have to go to a senior staff member afterwards. So you can also send staff work back to a staff member of a lower level if you think that their assessment needs a little more information. We've also got transparent communication. So just here we have an example of an applicant actually being asked to amend an application. So here they get an update in the system and an email saying your medicinal product registration application here has an error that you need to fix up. So someone has reviewed this, they can then go into the system and clearly see what needs to be updated. In this case, it's a bit blurry to read, but they've been asked to update the schedule of the medicine as it's incorrect. And so they're not able to resubmit the form until they've corrected that error. So why we do this is to make sure both sides, there's a clear track of everything that's gone back to applicants and coming into the regulatory agencies to ensure that everyone's understood and meeting the requirements. The last one is documentations and records. So as I mentioned, the whole point of digital storage is to make documentation easy to pull up at any point in time. So I'm just going to give an example of, I've just looked at a medicine for diabetes. Someone's maybe complained at a facility that they're not sure if it's the correct product. If we're able to find the record in the Conforma database, we can go back to the original application here and we can scroll down and see what was originally submitted. In this case, I'm scrolling down all the way to see what labeling was submitted to actually see if it matches the product that's been reported or found at the warehouse. So in this case, I'm able to go to the original data, pull up the label, and that's always stored. So throughout the life cycle of a product, we keep everything related to it into the database entry. And that includes if it changes, if there's been any correction requests. All right. So part of implementing a system that actually is owned by countries is, of course, making it sustainable and cost efficient, and something that can actually change as your agencies changes. So we know that there's no one size fits all. So we've designed Conforma to be updated without development. I don't know if anyone is into IT here. I've been very quiet, but if I can develop it with my skills, then I'm very sure that the IT departments in countries with training can do that. So what that means here is we can see our template builder here. It means we can update forms without turning off the system, without breaking something. So if you have an additional requirement, maybe after a year, you would like to add a new document. So maybe you weren't ready to start assessing certificates of analysis back when you first implemented a workflow. That we don't have to wait. We can start doing what you can now and then build it up as your capacity strengthens as well. So we're able to log in, click the new element button and add a new field to collect a certificate of analysis, turn the new form on live, and the new process is updated. Almost everything in the system is customizable and adaptable in our template builder. And what that means too is that you don't need to always be contacting the mSupply Foundation to update the app. With training, you're able to do it yourself. Of course, we always love to help. And there's a lot to learn, but I think that it's a very good tool that if you have embedded in your country's workflows, that you're able to keep them up to date without spending extra money. So I've got some mentions here, managing versions, you're able to update certificates and databases, and of course, turn off workflows with or without development, just with a click of a button. Of course, can't talk about a software by the mSupply without talking about how we hope it will connect with mSupply. So we hope to integrate Conforma with mSupply so that regulatory information is syncing all the way down to the stock level. Just some examples just off the top of my head is when we're procuring items, if we're able to automate the information from the procurement process all the way down to the stock level information in mSupply, reduces the data entry for who the manufacturer is, and allows for easy identification of products down at the lower level facilities. which can also assist in alerting for recalls or finding out if there's been a substandard notification of a product by WHO, being able to quickly see, great, these 10 facilities have an item that matches that, so we better investigate. We also integrate with our mSupply dashboards for customizable reporting. So here's an example of an in-depth reporting for a specific product group. So this is for antimicrobial medicines. The mSupply dashboards can be set up to manage anything, I guess, that's related to the system for workflows and your management of that. But this in particular is looking at the number of registered antimicrobial medicines, how many companies are importing antimicrobial medicines into the country, and also who they are. So just having this data creates opportunities for monitoring and having different targeted policy approaches related to AMR medicines. For example, if you have 10 of the same product, or you have an inefficient combination of antibiotics being brought into a country, that can be alerted, and then something can be done from it. All right, I think that's enough from my end. I'm going to pass off to Emi, who's going to talk about how it's actually gone in real life.
Thank you, Jessica. Thank you, everybody, for coming. Yes, I'm Emi, and staff working at the Medicines Regulatory Authority. Okay, just before I continue, I think I understand not all of us are regulators. So I just wanted to briefly share the role of the Regulatory Authority and why this system is so useful for us. So regulatory authorities are market gatekeepers or compliance enforcer to regulatory requirements. In terms of medical products, patient protector. So medical products are a major part of an effective healthcare system. So it's very important that regulations are in place to make sure that these products are of good quality, they are safe and effective. So regulations have developed over the years, especially after the crisis with thalidomide, for those of you who are aware. And we make sure that through regulations that life is guaranteed and that it facilitates universal health coverage. And one of the very important things we need to bear in mind is that, especially in the private healthcare system, that business interests should not impede access to healthcare for innocent patients. These are the operational functions of the Fiji MRA, of Medicines Regulatory Authority. Like Jessica has mentioned, medicines registration and import authorization. We also very much involved, as we are doing right now, with the product manufacturer assessment or pre-qualification for the public sector. The compliance, ensuring compliance through inspections of premises and practice of pharmacy in Fiji. Post-marketing activities like pharmacovigilance and drug testing. Also, we offer regulatory support and education to other stakeholders like the border control officers, the courier companies, the police, in terms of training and offering regulatory advice. Apart from the above, we are also, the Fiji MRA is also secretariat to the two boards that govern medicines and the practice of pharmacy, which is the Fiji Medicinal Products Board and the Fiji Pharmacy Profession Board. Now, medicines registration, just to emphasize the importance of this, it actually ensures the quality, safety, and efficacy of medicinal products, not just in Fiji, but anywhere in the world. This is important. We may be thinking, we are talking a lot about ensuring stock availability and avoiding stockouts. What's really important from our point of view is the quality of what we have on the shelves and ensuring that they are safe. Also, medicines registration in Fiji, there's provision for this in the Act, in our laws, in the Medicinal Products Act, and also in the National Medicinal Products Policy. The MRA in 2020 underwent a WHO GBT assessment to actually assess our maturity level. The maturity level of regulatory authorities assessed on a scale of 1 to 4, ML1 to ML4 for those that have well developed. So Fiji is just about reaching ML1. So after this GPT assessment in 2020, an IDP or institutional development plan was drafted with stakeholders around the country. And the IDP actually identified priority areas that we needed to work on. And we had picked up activities that we were sure we could achieve by 2023. The main one is actually drug registration. But the problem was we didn't have a system to actually facilitate this process. It had been one of the main activities of concern for probably 7 years. And we couldn't really get it going because we didn't have a system to support this. So we're thankful to the Australian government through DFAT and the mSupply for enabling us to be able to achieve this this year. So in 2022, the system was developed, and so we had started using it from March this year. So the system is Conforma, which is the online service portal, and it's web-based, as mentioned by Jessica, and designed for registration of medicinal products in Fiji. So at the moment, it's currently used for provisional registration. Now, this is our initial step towards full drug registration. We cannot start right away with medicine registration, a full registration, because our markets are already full of products that are currently being distributed, that are sold, and it needed to be done in a stepwise approach. So fortunately, provisional registration is already provided for in our laws. So we are actually implementing them at the moment. The other word we can use for that is listing, where it's actually just listing medicines in a register to give the MRA regulatory oversight over what's available in the country right now. Also, Conforma is used for pre-qualification of products and manufacturers for government procurement. Right now, we are Fiji is in the process of tendering our medicines. So every supplier that's intending to supply the government will have to apply for pre-qualification through the system. This is to be a manual product, a very overbearing kind of work for the MRA, where only one staff does the work. So because of Conforma, we are able to do this. And so far, we've actually reviewed more than 100 manufacturers, and we still have a few others to work on. So for pre-qualification, we are also using the system for import control for chemicals. These are industrial chemicals. It's another workload lesson for us. Chemical imports used to be done manually, and it was a lot of work for the chemical importers and also for our office. But because of Conforma, we are able to do this work in just about 2 minutes, and their permits are processed in the system and emailed to them without them having to personally come for collection from our office or for us having to send it through courier. So we are actually looking at extending this work using Conforma for registration of pharmacists, for import and export of permits, for controlled medicines, which are still being done manually, and also to be able to do import control for all medicines imported into the country, and also for the registration of medical devices. So provisional registration requirements, this is where we are at the moment. We are listing products from every importer in the country that's bringing in medicines for distribution, mainly in the private sector. So those are the basic requirements, and it's very easy to give to actually fill in the forms that with these basic requirements for registration. At this moment, we are not sorry, for provisional listing. We are not assessing them for approve them or declining any if they do not meet the requirements. We haven't gone into the full registration process yet. At the moment, we are just listing products with a minimum information required from importers, and having this in our register. And now those requirements are now transformed into that particular form. It makes it very easy for applicants to give the information and upload the necessary documents. And it makes it easy for us as well to assess, to review, and include and approve this for listing. We also have a dashboard that's quite useful at the moment. We're able to track the progress of our work. So what you see on the board is actually the number of sponsor companies that have registered to list their products. This includes all our pharmaceutical wholesalers and the private hospitals. And also on the blue box, in the blue box are the number of applications submitted so far. And the green box, the number is the number of products that we have provisionally listed. So the dashboard actually makes it easy to export and share data, monitor workloads and application numbers, and also helps identify trends of priority work areas. It's quite easy to use the system for those that have already started using it. And like Jess has mentioned, we hardly received any complaints of anybody having a problem using it. It's very user-friendly. And so it enables them to actually log in and log in as users, register their companies, and start filling in the application form. This is our phased implementation of Conforma. If you look at the graph there, the timeline, we actually commenced provisional registration in 2023 and March this year. Before this, we had the system developed, and we had all the importers called to a workshop to actually introduce them to the system and why we were doing drug registration. And so that was done last year. And so we had them trained also at the beginning of March this year. All importers were called in to be trained on how to use the system. And later on, during the same month, the system was actually open for applications to start to be submitted. And in a year's time, we hope to be able to also start with importation, issuing importation permits for every consignment of medicine that comes into the country. So this will allow importers to only import what's already provisionally listed. And if they haven't, they have to make sure that this goes into the provisional register before they can import this into the country. We hope to be able to work with the customs or the border offices to ensure that this works well. And also, while importation process opens, we also hope to start the full registration of products at this time. So currently we are informing all our importers that they need to start to try and finish provisional registration within a year, and from next year onwards to move towards full drug registration. So if they have already provisionally listed their products, it should make it easier for them to actually move towards full product registration. This will continue until 2025, when provisional registration will close, and we will have to have every importer start with a full registration of products from then on. Because products that are in the provisional list may take a while to actually phase out. We've given them another year, up until 2026, when they can continue to use those provisionally listed products that have not met the full registration requirement. So by 2026, there should be no more provisional listed product in the market, only full registered products. And from 2026 onward, so we hope to be able to continue with the full drug registration. Again, we just want to show a video of the current provisional registration process that's available in our Ministry of Health website. Yeah, so moving on to pre-qualification, this has always been an ongoing process for all medicines that are supplied to Fiji for the government sector. So it's more or less like a registration already. It's much more stricter than what is required from the private sector at the moment. So every supplier that supplies medicines to the government of Fiji will have to have their manufacturers pre-qualified first by the MRA before they can supply a product. So at the moment, we are currently doing pre-qualification for the government tender, and we are working on with suppliers in this area. We've actually managed to approve quite a lot of manufacturers through the system. It's made it easier. What used to take us months now only takes us a few days or in weeks to do because of this system. So lastly, I would just like to briefly talk about some of the advantages of the system. There are actually more that we can mention, but it has been made our processes very efficient in terms of issuance of import permits for chemicals imported into Fiji. It reduces our resources, both for the MRA and also for the applicants. It is very user-friendly, like Jess has mentioned, and readily accessible. It is web-based, so it ensures that there is no interruption except in the events where there is no internet connection, and it saves data automatically, so there is no risk of losing data. And it's we have a very great technical support team, so I'd like to thank the team that's working with us, Carl and Jess, in helping us develop the system and customizing this for Fiji. Our concerns are usually addressed very quickly, and any amendments are done in a very efficient and professional manner. Also, it creates a database which makes it very easy to access information, and the dashboard helps us track our progress. Also, for pre-qualification, like I've mentioned, it saves reviewers' time and maintains a database of pre-qualified manufacturers for future references. Also made a provisional registration possible, which is our, once we move towards full drug registration, it has taken almost 7 years, as far as I can remember, trying to figure out how to do this. And so it's been made very easy and efficient through Conforma. It saves our work as we go, like I've mentioned, so there's no risk of losing data. It makes it easier to also comply. So for those whose products are already in the provisional register, it makes it easier for them to have the products pre-qualified for supply to the government currently. And it also streamlines our processes and removes duplication of work, and so reduce workload.